Do something every day that brings you closer to your goals. Welcome back to our channel. This lecture is on a very important topic, that is oral hemangiomas and vascular malformation. Oral hemangioma is a routinely asked long answer question or an essay question in your exam, so watch this lecture carefully. The other name for these lesions are oral vasoformative tumors. Now, hemangioma are not present at birth. They manifest in the first month of life. It undergoes rapid proliferation phase and slow involution. There is rapid proliferation of endothelial cells in the hemangioma. While vascular malformations are anomalous development of vascular plexus showing normal endothelial cell growth, and these vascular malformations do not involute, that is, there is no regression. So the key difference between vascular malformation and hemangioma is that vascular malformation do not involute or regress, while the hemangiomas, they undergo regression. Now, the etiology of these lesions is unknown. It is thought that the trophoblasts, which are present in the embryonic life, are the source of origin for these lesions. Some secondary events occur in utero, and this leads to hemangioma. Now, the pathogenesis, there are three stages of etiopathogenesis of this lesion. First stage is the undifferentiated capillary network stage, second stage is the retiform developmental stage, and the third stage is the final developmental stage. The undifferentiated capillary network stage shows that the primitive mesenchyme is nourished by interlacing system of blood spaces. In the retiform developmental stage, which begins at 48 days in utero, separate venous and arterial stems appear on either side of the capillary network. In stage 3, that is in the final developmental stage, which starts at 2 months, gradual replacement of immature plexiform network by mature vascular channels occur. Now the classification of hemangiomas. In 1982, Mulliken and Glowacki divided the lesions in two groups. First is the hemangioma group and second is the vascular malformation group. The vascular malformations are further divided into four categories: venous, capillary, arteriovenous, and lymphatic. Now, Bateson and McCarthy has also divided the hemangiomas into several types. First is the capillary hemangioma, then comes the cavernous hemangioma, then comes the angioplastic or hypertrophic hemangioma, then comes the racemose hemangioma, diffuse systemic hemangioma, metastasizing hemangioma, nevus venosus or the Portwine stain type of hemangioma, and the hereditary hemorrhagic telangiectasis. Now, the clinical features: 23% of the lesions occur in premature infants weighing less than 1000 gram. Then it occurs in second decade of life, and whites are more affected and females are more affected. While the vascular malformations show increased incidence than hemangiomas, they also occur in whites, and male and the female ratio is 1:1. Now, in jaws, mandible, maxilla and the nasal bones are affected. Mandible to maxilla affected ratio is 2:1. The intramuscular hemangioma mostly occurs in the masseter muscle. So this is an MCQ question. The intramuscular hemangioma in the head and neck region occurs in which muscle? The answer is the masseter muscle. Now here you can see the clinical picture of hemangioma. Coming to the oral manifestation, intraorally hemangioma appears as a flat or a raised lesion, deep red or bluish red in color, well circumscribed, and it is compressible. Sites of occurrence are lips, tongue, buccal mucosa and palate. So here you can see intraoral hemangioma. Vascular formation of the lip vessels may appear as microcherry, glomerulus and venous lake. So here you can see a hemangioma affecting the lower lip. Now intramuscular hemangioma, it is quite rare in the head and neck region. Less than 1% lesions occur and the most commonly affected muscle is the masseter. Central hemangioma occurs in the first and the second decade of life. Mandible is more affected and it is a destructive lesion. On X-ray, it may appear as honeycombed or a sunburst appearance similar to osteosarcoma. So here you can see the sunburst appearance of central hemangioma. Now, AV aneurysm or AV fistula is a direct communication between an artery and a vein, and the circulation occurs by capillary circulation. There are three types of aneurysm: cirrhoid, varicose and aneurysmal varix. Cirrhoid aneurysm is a tortuous mass of small arteries and veins linking larger arteries and vein. So here is a clinical picture of a cirrhoid aneurysm. Then comes the varicose aneurysm, which is nothing but an endothelial lined sac connecting artery and vein. Aneurysmal varix is a direct connection between artery and dilated vein. Radiographic features: it is a well corticated radiolucency showing soap bubble appearance. So here you can see the soap bubble appearance of the hemangioma. The histologic features show small capillaries lined by a single layer of endothelial cells, and it contains young granulation tissue. Here you can see numerous blood-filled spaces lined by endothelial cells. Then there is increased endothelial cell proliferation in the lesion. Cavernous form shows dilated large blood-filled sinuses lined by thin walls of endothelium, and they are blood-filled. Picture of cavernous hemangioma showing dilated blood-filled spaces lined by endothelial cells. Then the intravenous angiomatosis is also called as hemangioendothelium vegetant intravascular of Mason. It is an unusual thrombus. The salient features of hemangioma in its proliferating phase show endothelial cell hyperplasia, thickening of the endothelial basement membrane, increase in the mast cells, and increased uptake of Xtritiated thymidine by the endothelium. Hemangioma in its involuting phase shows reduction in the mitotic activity, Fibrofatty infiltration, normal count of the mast cells, and no uptake of Xtritiated thymidine by the endothelium cells. Vascular malformations show no endothelial cell proliferation but large blood vessels having unilamellar basement membrane, normal mast cell count, and no Xtritiated thymidine. Treatment of hemangioma includes surgery, radiation therapy, sclerosing therapy, cryotherapy, and compression. Next lecture will be on Rendu-Osler-Weber syndrome. Thanks for watching this lecture. Happy studying!